Hello, hello, hello. Welcome to the Health and Wellness Show. We are grateful unto God for giving us the opportunity to come to you once again. My name is Ms. Dell. I'm your usual host, and I welcome you all to join us today, even as we go through a very important healthcare topic that concerns us in our society. So welcome once again. Kindly share the link, call your friends and loved ones to come and listen to the tips and advice from our healthcare professionals. Again, you are welcome. My name is Ms. Dell. All right, then. So I'm going to go straight ahead to introduce our special guest today in the studio. I have two beautiful ladies here joining me today to discuss this a very important topic today. Today, our topic is STI, sexually transmitted diseases. Yes, I don't think it's something we like talking about, but it is very important and it concerns everybody. Anybody can be infected by this disease. So two beautiful ladies here are here to talk to us about STIs. So I have here Joanne Asafu Eje, who is a family nurse practitioner. And then I also have Clara Menu, who is a registered nurse. And these beautiful ladies belong to a very dynamic association called the Ghana Nurses Association here in the Dallas-Fort Worth Metroplex in Texas. So if you're a nurse out there and you're in Texas or you're in Dallas or DFW Metroplex and you're not part of them, please join them because they're doing a very great job. They go to Ghana back home. I think it's every 2 years or every year they go and they give back to the community. They give back to the society. They are doing great things in Ghana. They travel all around the length and breadth of Ghana to provide healthcare advice and give the big donations as well, and even go and work with the nurses and doctors in the hospitals. They're very hands-on. Can you imagine? And you know what? They do this out of their own pocket. They do this out of their own pocket. What a great job you are doing. So kudos to you all. Please let all your people know that we appreciate what you're doing in our community and keep on, and we'll keep supporting you as well. So that is the main reason why it's part of the community work, and they're still here today to educate us as well. So welcome, ladies.
Thank you.
Thank you, Ms. Dale.
All right. So we'll go straight to the presentation. I'll hand over to you all to take us through.
Thank you. Let me just open here up. All right. Thank you so much, Ms. Dell, for having us on your show. We truly, truly appreciate you, and we hope your viewers will enjoy this presentation and learn one or two things today.
Definitely.
So, just a quick thing to say. I know presentation today, like you rightly said, is about STIs, STDs. Um, I know it's an uncomfortable topic. We were supposed to have this presentation last month, which was the infectious disease month. But unfortunately, we're having it today, but it's never too late. Any day we get this information is the right time for us to have it. So thank you so much. And I just want to take this new thing going on in Ghana saying "wechiguho," which is like your back is exposed. You know, we none of us have STDs. None of us will ever have STDs. But guess what? It is there. You know, so in as much as we don't want to talk about it, it is there. It is in our community. It's in the. It's everywhere. So I think it's really right that we educate everybody about it. And they say prevention is better than cure. So giving us the tools to be able to prevent it will be the right way to go. So I'm just going to start off with some and share some statistics, you know, especially in the DFW area, which is where we are located. Okay. So in the Dallas area itself, it's reported that as many as 20,400 cases of chlamydia. And my Miss Clara will be going ahead and telling us about the different forms of STDs that are available. But I'm just going ahead, just blankly. So chlamydia cases are like 20,400 that are reported per year in the Dallas area, which means about 783 people out of 10,000 or 100,000 residents have the chlamydia. So that makes it very, very common. Gonorrhea is about 9,300 cases that are reported annually. And with HIV, we see about 20,500 people in the Dallas area as of right now have have HIV. And so you see that this is really, really predominant and it's really there for, I mean, that anybody can get it. When we go over to the Tarrant County is seeing over 4,400 cases of gonorrhea each year and have almost 8,000 residents who are actively living with HIV in the Tarrant County. This makes this quite serious and worth us learning about to prevent these cases, loved one or even us from contacting these diseases. So I'll hand over to Miss Clara to tell us a little bit about this STDs, STIs that goes on in, around.
Thank you, Joanne. And also, I want to thank Miss Dell for having us today. So yes, as we all said, that the topic is a little bit, people don't want to talk about it, but this is the real world. We have to talk about all these issues that affect our community as a whole. And in educating our people, our communities, we can prevent all these diseases. And also, in case you get infected, you still have resources where you can go and have and get some help. So, with that said, usually the question that comes up is, what are STDs? Because sometimes we have the teenagers that are coming up in life, and then we have the 30-year-olds, 35-year-olds, and then we go upwards to the age. So usually they don't know what STDs are. So the STDs, these are it's a virus. It's a virus that occurs and is transmitted through a virus, through a person to person contact. It's whenever the infection is now noticeable, the there's always an organ that is damaged. So then once the organ is identified and is damaged, then it becomes an STD, because it's confusing when we say STI and STD. So when the STD, it becomes an STD, that's when the symptoms are noticeable and they are showing up, and now we can call it an STD. Okay? So as we said before, it occurs as a virus, a bacteria or parasite from one person to another through sexual contact. Okay? So, however, there are major categories for the STDs. Now it's an organ damage. Now we're calling it STD. So, the STD, the major categories are bacterial, um, which comes under chlamydia, gonorrhea, and syphilis. Okay. These are curable, which is good, and with targeted antibiotics regimens when it's diagnosed early. So when you get treatment early, you will get a cure. Okay. But once you are late, there will be some damage of some sort. Okay. Now, another category of STD is viral, which is HIV, HPV, herpes, and hepatitis B. Okay, these STIs are virals, they're generally manageable with antiviral treatments and vaccines as well. Okay, the HPV has a vaccine. You can do that as early as a teenager, and go to the resources, go to the clinics, they can do an HPV vaccine for you. All right. Now, the last one is the parasitic, which is trichomoniasis and pubic lice caused by microscopic organisms or parasites, highly treatable with anti-parasitic remedies. Okay? So, with those categories, at least we have cure if you come early. Get treatment early if those symptoms are coming up, or you're just feeling a little bit weird, or something is wrong, something is not right. Just trust your gut feeling. Go get treatment, go get checked so that you can prevent the organ damage. Okay? And I believe we're going to pass this on to Joanne. The next topic.
Thank you. Of STIs to STDs
Joan
that
is
are.
muted. I can't hear her.
Okay, thank you, Ms. Clara, for educating us on the different modes of transmission on STIs, which leads to the STDs. So, why do we need to have regular testing? There are complications from STDs when people get it, especially like untreated STDs could lead to pelvic inflammatory diseases. It could lead to chronic pain. It could even lead to infertility. In both sexes, and also people could also get HIV. And then how do we stop this transmission? Knowing our status, knowing our numbers will help us to protect our partners. It will also allow us to break the infection chain and allow us to also practice responsible sexual behaviors. And also knowing that you do or you don't have it also can you can get early treatment, which will lead to cure or to lead to remission in the cases of viral infections. Now, there are screenings that goes on, throughout our lifetime, and I'll encourage everyone when you go to your annual physical to ask about these preventive screenings. And most insurances cover STD screenings. So it's not like you're paying anything extra to get them done at your doctor's office. So generally, teenage years all the way to people less than 25 years when they come to the doctor's office for their annual visit. Routinely, it's recommended to check for chlamydia and gonorrhea. And how it's checked is through the urine sample or giving them a swab, swabbing the area and using that discharge to check for these bacteria, because it's known to be very prevalent in those years, those ages. Also, all adults, I would say from ages 13 to 64, it's recommended that at least one time in your lifetime, if not once a year, to have an HIV screening, and that is done through blood test. Pregnant women also are screened for syphilis, are screened for HIV, hepatitis B, and hepatitis C. And this is done early in the pregnancy through blood work as well. And especially if you have a new partner or you have multiple partners, we recommend every 3 to 6 months to get a comprehensive STI panel, which can be done through the blood and also through urine. Now, how can we prevent STDs, STIs? Consistent and correct use of external and internal condoms, and there's something called a dental dam just for people with, if you engage in oral sex, this reduces the risk of all STDs. And talking about this, I had a patient who came in with pharyngitis, that is sore, pain, sore throat, bacteria, sore throat. And when we tested, even though she wasn't like having intercourse, she had been doing oral sex. And by that, she had chlamydia infection in her throat. And it was pussy, it was swollen and all that. So just only doing oral sex does not keep you, you're not safe. So get all these tested. And if you know that you do oral sex, also allow the practitioner, the provider to know to swab your throat as well. There are also vaccinations that will help to prevent some of these diseases, STIs to STDs, such as hepatitis B vaccine, which is known to give you a lifetime protection against that virus. And that is now it's a 2-part series, and once you get it, you're protected your whole lifetime. So it's also good when you go see your doctor to get screened to make sure that you already have the immunity. And if you don't, then the doctor will get you those shots to give you that immunity, and that will not be your headache after that. Another screening that I also recommend to our people ages 13 to 25 on the kids is to do 13 to 26 is to get the HPV vaccine. I know there's a lot of parents who say, no, my child is not sexually active. My child will be abstinent till they get married and all that. But we don't know who their partners are going to be. So I really, really recommend that children be vaccinated for this HPV vaccine, which has proven to prevent most of these HPV infections in about 90% of the population. And also, we also know that HPV can lead to a lot of cancers, cervical cancer, skin cancer, a lot of them. So once you get it, you are protected. So there's no need to not, and it's available at no cost if you are between 13 and 26. So there's no reason for us not to get this important vaccination. Another thing is also have open communication about your sex history with your partners. Screening, sharing your screening results, and also, before sexual activity, especially if you're not married, or even if you're married, but, you're not in monogamous relationship, it is very important that every 3 to 6 months you getting yourself tested. If you are getting into a new relationship, I always tell my patients, share your, just like birth certificate or whatever, share your STD results with each other, because it's very, very common that, people may be hiding their status. So you go get your STD testing, let him or her also get the STD testing. Both of you share your status, so both of you know where you each stand before you get into before you have sexual relations. This will save a lot of headaches in the future. Now, what if you have it? Is it curable? Yes, it is curable. Some of them are curable, especially if it's bacteria or parasitic. So some of the bacteria infections, we are looking at chlamydia, syphilis, gonorrhea, trichomonas, BV, all these can be, all these are STIs. And once you have them, they can be treated early. Early intervention will help you from the complications we talked about in terms of the PID, which is a pelvic inflammatory disease, and or cancer and all that, or infertility. One that comes to mind, and we have to take it very serious. I had a patient that kept talking about having UTI and blaming roommate for not cleaning the toilet and all that. And finally, I decided, let's do, STD testing and see. And surely this child had chlamydia. So, and we were able to treat it. Now, this could have gone on for a long time with her talking about having UTI, and who knows, in the future we'll blame, have blames of witchcraft and all that because they can't have children. And this is because they had chlamydia that was not treated. So let's take this very, very seriously. Now, in terms of preventing viral STDs, we do have what is that called? HIV. Right now, there's medication out there called PrEP therapy. PrEP, yes. So talk to your doctors about PrEP therapy if you know you're not in a monogamous relationship, or you just don't feel safe, whatever be the case. Now, you being on the PrEP therapy, which we have different forms. There are those that you can be on like every other month, and now they have one that you take it just twice a year. Now, being on this is also proven to be 99% effective in preventing HIV. And it is also available if you have insurance, or even getting a discount, medication discount from the manufacturers as well. So all this is to prevent people from getting these diseases. So like I said, there's no reason for anybody to be going through the complications of STD, STIs at this point. And just talk to your doctor, get these treatments done, PrEP therapy, immunizations, yes, and also regular testing will help us. So at this point, also, because the next thing is, where do we get the testing done? I'm going to switch over to Ms. Clara to tell us in the Dallas-Fort Worth area, places that we can get tested or screened with or without insurance if you can go to your doctor's office.
All right, over to you, Miss Clara.
All right. Thank you, Joanne. So I'm just gonna carry over and piggyback from Joanne. Um, we're just gonna repeat this again. Why regular testing matters. 70% of chlamydia and 50% of gonorrhea infections in adults present no symptoms, no noticeable symptoms. So that is why testing, routine screening and testing is so utmost important. And it is confidential, by the way. And testing also protects your personal well being and sexual partners while enabling immediate access to medication, and resources that are available to you. Okay. So, testing and clinical resources in the Dallas Metroplex area includes the DC. You can see it on the screen. Can you show the resources on the screen, please? DC HHS main clinic on Stemmons Freeway. They do full STI, HIV, syphilis treatment, low cost sliding scale. So you might pay, you might not pay. It just depends. Then they also have the DCHHS mobile unit. It varies per community. So it just depends when the big van that you see sometimes in the community, the Dallas community events as well. They do rapid HIV, syphilis, chlamydia, and gonorrhea. It's 100% free and very confidential. So it's good to go with your partner if you think maybe they need some screening and go there. It's private and confidential. AHF Wellness Center. This is in Cedar Hill. Free STIs again, free HIV, PrEP, PEP care, for free walk-in services. And then there is the Prism Health North Texas. They have multiple locations in the Dallas area. They also do comprehensive STI screening and treatment. Insured, uninsured, all people can come through. Okay. Now, the Tarrant County side, Tarrant County Public Health is Main Street, downtown Fort Worth, confidential STI examinations, low cost sliding scale. Also in Fort Worth, they also have AHF Wellness Center, Beach Street, Fort Worth. Walk in, STI screening, free treatment, it is free to the public. Planned Parenthood in Fort Worth. It's on John Ryan Drive, Fort Worth. They have full, broad spectrum sexual health care and STI testing. Healing Hands Ministries, I've heard of that one. They're very good. North Dallas, Richardson area, community wellness and STI lab screenings as well. So, when you're going for your testing, I know it's very scary. You feel anxiety, your privacy, you feel like it's been invaded, but don't worry. Everything is confidential and private. Results are strictly protected under the federal HIPAA privacy regulations. So we are protected under that law, okay? We also, the advantage of testing as well, it provides you with rapid results. Rapid HIV tests provide results within 20 to 30 minutes. How is that? That's great. Lab STI panels take 1 to 3 business days, but at least the HIV is faster. Another advantage, no insurance needed. Public clinics offer testing regardless of insurance or citizen status. Okay? So you can still go and get help. Um, the advantage of what to expect during testing as well is immediate care. So, positive results come with a direct access to medication, treatment, and your partner can be cared for as well. Okay, it is very a sensitive topic that we're dealing with in our community, but we still have to speak about it and give each other resources so we can prevent and find a cure as quickly as possible. All right, over to you, Miss Dell.
All right. Thank you so much, Miss Joanne and Miss Clara. Well, this has been a very informative session. All the information that you've given unto us right now is very vital for us to keep, to also educate our children, especially our children, our upcoming children. Is the world is getting scarier and scarier. So all these information are very vital, and we thank you so much. At this point, I'm just going to go ahead and I'll take some announcement. I'm just going to announce the programs that we have on this channel, and then we'll come back and ask questions from the presentation that we just had. Okay, all right then. So this is the Sienna Media. We are on Facebook. We are on YouTube. Please share. Always share and send this all the videos that we have. Send them to your family and your friends and your loved ones for them to also watch and listen and also learn from it because we are all learning. I always say this is the hub for free. This is free healthcare advice. If you book an appointment with a doctor or a healthcare practitioner right now, just a consultation, we all know it's not free. You will pay consultation. Even if you have insurance, you're still going to do some little out of pocket. Okay. But over here is very free. And we have seasoned and well experienced qualified professionals, healthcare professionals, doctors, nurses, and what have you who come here to offer these advices for free. So let's not take it for granted. Let's listen, let's take the advices, let's act upon whatever we've been told to do, and also share so lives are saved. All right. Okay, so on this channel, Friday evening, our own DJ Lawrence comes on with the African jazz and traditional music panorama. If you want to hear some very beautiful, nice African tunes, just log on to this channel every Friday, 8 p.m. Eastern Standard Time or 7 p.m. Central Standard Time for your Friday relaxation. And it's being hosted by our own DJ Lawrence Mawenyega. Yes, all right. So, and then on Saturday morning, Health and Wellness Hub, we are here. I'm your host. We also have our motivational speaker, Sarah Adaji, who also comes to give us motivation for the week. We are here. We host health season and well experienced healthcare professional who come to talk to us on various healthcare topics. As I said, it's very free over here, so it doesn't cost you anything to log on to our channel right here on YouTube and on Facebook to listen and watch and get some quality advice from our seasoned and professional healthcare people who come on here. All right. And after that, we have the Sienna Talk Show. This is Sienna channel, so Sienna Talk Show. If those of you are not aware, Sienna is the Council of Area Associations in North America. So all the area associations in North America have come together to form Sienna, and Sienna every year hosts a very big conference where we all come together. We raise funds to go do a lot of projects back home to help our brethren back home as well. And we also benefit from all the projects that we do back home because what? Most of us retire and go back home. We usually go for vacations back home. So if we don't help to make our nation good and strong, or we don't help make the place a better place, when we go back, we're also going to be affected. So that is what Sienna is all about. So we have Efo Steve and Empress Mausi who come on. They are the hosts for this talk show, and then they also host or they also invite guests to come talk about all that is going on in Sienna. Apart from the conference, the yearly conference or annual conference, there are projects, a lot of projects that are ongoing back home, and so they come and then host the show, and then everything that goes on Sienna is talked about at the Sienna Central Talk Show. So after that, all the way to Ghana is Dunyanyo Bobobo. This is hosted in collaboration with Top Radio all the way from Ghana, and is hosted by our only authentic Mama Emifa. She's the host of the show. She also hosts a lot of dignitaries in Ghana who come on the show to talk on various topics, especially topics or people who in regards to our Everland in Ghana. So that is Dunino Bobobo show. Yes, right after the Sienna talk show. So that is at 1 to 3 p.m. Eastern Standard Time and 5 to 8 p.m. GMT time. That's Ghana time, West African time. Okay. All right. And then after that, we have Miss Stromberg. Miss Stromberg, yes. Sienna is about developing Everland. So we need to develop and learn our language, the ever rich, ever language. And so we also have Dr. Wanyo, Dr. Dogbe, and all the other people in his entourage will also come on here to teach us our rich language. Yeah, we all need to learn it, and then especially our kids who are our children who are born away from home also need to learn the language and understand it. So they all come on here to teach us the language um, right after the Juninho Bobobo show. So it's every 4 p.m. Saturdays 4 p.m. is 3 p.m. Central Standard Time and 1 p.m. PT time. No, it's 4 p.m. Eastern Standard Time, 3 p.m. Central Time, and then 1 p.m. PT time. Yeah. So that is it for doing River Mr. Come, let's learn ever. That's what uh, it means. And then, so that's it for Saturday. And then on Sunday, we have our sister who Nicole, who comes here to talk about our faith and our culture. She also hosts this show. She comes on here. She brings a lot of people or a guest on here to talk to us about our faith and our culture, our rich African culture. Oh, we can never go wrong about this. So basically, these are the shows that are on this channel for now. Yes, later on, a lot others are gonna be a lot other shows are gonna be broadcasted, so please be on the lookout. But for now, these are the shows that we have on here on the Sienna Media channel on YouTube and on Facebook. All right. So we will go ahead and welcome back, Miss Juan and Miss Clara. All right then. And so we have some few questions here for Miss Clara, Miss Juan. Um, is it only heterosexuals who acquire STDs?
I'll take that question and I would say no. Even in homosexual relationships, diseases are passed on. I've had a few patients who are in homosexual relationships and have come up with HSV, both 1 and 2. And let me say this right here quickly. Let me say this. So as we know, HSV 1 and 2, so 1 is the cold sores and the 2 is the genital. That's where people have cold sores or what we call fever blister. So one caution that I want to throw out there to our community is please do not allow people to be kissing your kids on their lips because you don't know what they may have. So, baby's cute and all, and the next minute, they can transfer it to that person in that sense. Also, if you have it, of course, there are medications that are available that you can take to suppress it. And as long as you taking your vitamins, you eating well, you can suppress it, but it can still be passed on. There's a phase that we call shedding, so you can still pass it on. But if you do, just know what to do, what not to do. Don't share utensils with anybody when you have those fever blisters or genital, that. So I want to say that I've had patients in homosexual relationships who have, skin rubbing and all, have also had HSV too. I've had them using toys, those things that people use, the toys, and they've also come up with chlamydia, come up with bacterial vaginosis. And again, let me go back a little bit on bacterial vaginosis. This is sexually transmitted, but mainly affects women because, of course, the man doesn't have a vagina. So they will carry it, but they will give it to the woman. So if a woman has it, in as much as the woman gets treatment, you need to have your husband get treated or your partner get treated for it as well, because he or she, whoever the other person is carrying the bacteria and will give it back to you. So you see patients having it back to back to back, and you just keep taking antibiotics and taking antibiotics, and get reinfected, which in the long term is not good for you anyway. So yes, using those sex toys, make sure that when you finish, you clean it very well and sanitize it, store it well. Because if it's used on one partner, not cleaned, or another partner back and forth, you can definitely pass it on to another person. So being in a homosexual relationship does not exclude you from getting STD or STI. So let's be mindful of that.
Wow. Thank you. Thank you so much for that explanation. So let me ask. So does it mean it's the end of the road for somebody who is diagnosed or who gets STI or STD?
Um, Let me answer this one. No, it is not the end of the road. So it just depends what infection you have, like the curable ones, the chlamydia, the gonorrheas, and all that. As soon as you get treatment, the better. But however, when it comes to STD, there's some organ damage. So that's where sometimes it can be challenging. And it also depends on what other diseases that you have as well that's going to compound the STD. Okay. So if you have, maybe you've had an opportunistic disease, or maybe you have pneumonia, just never know what's going on with the body. And it also depends with your age as well. So if you're older, more problems. Okay. But with that said, the earlier the better. The more treatment will respond to you, because sometimes there'll be non-responders. They will be given treatment, but it takes a long time for them to heal and get tested to be negative. But the earlier you do it, the better, and then you can get a cure as quickly as possible. Yeah.
Wow, awesome. So that's some good news. So
Mm-hmm.
once
Good
you
news.
realize something is not going on well, please, 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 we always
Quickly.
stress that on this channel. Early detection.
Mm-hmm.
Early detection is key, because once you're able to detect it early and seek for professional, you
Help.
know, advice or professional care, it counts a whole lot. It matters a whole lot. So please, let's look out. The moment we see something wrong in our on our bodies or something going wrong in us, let's seek for professional healthcare advice. Thank you so much.
And let
Okay.
me add this, not necessarily when you have the symptom,
Mhm.
because some of these are asymptomatic, like chlamydia. Again, I
Chlamydia.
keep going back and forth. Some of them you don't have any symptoms at all.
Mm-hmm.
So, if you know you are in multiple relationships,
Mhm.
if you know you are getting into a new relationship, prevention is key. Early detection is key. Every 6 months, get tested.
Okay.
So that way, if you didn't have symptoms but you had it, you can get it. You can get it checked out and all that. So yes.
Okay. So getting tested is the key.
E-
Yes.
Okay, all right. So in this case, getting tested is because you never know whether you have it or not.
Yeah.
Okay, all right. Thank you
Mhm.
for that. Thank you. Very, very important. And another very, very important question is how do we prevent our youth from getting to that point?
Come again.
How do we
The youth.
prevent our youth, our children who are upcoming? Most of them, especially our teenagers, when they're home, they're saints. But once they step out of the house, you never would know what they're getting themselves into. So, how do we prevent them from getting it?
Education, I will say, is key. Yes, and that's why I started off by saying "wechiguho" or "your back is exposed," because these
Mm-hmm.
kids, like you rightfully said, they are saints at home. But if you know the things that these kids know, it is crazy. I'm not mentioning any patient's name over here, so I think it's safe for me to say. I had a patient, a young boy, high schooler, and came in for STD testing. And, through the interview, he tells me because he had sex 2 days apart with two different girls, so, and this boy looks innocent.
Mhm.
There's no way I would have even thought he was doing that, but going to different sex partners back to back. So we never know what our kids are doing out there. Teenagers, they always feel they are immune, they feel nothing will happen to them and all that. So let's educate them, let's show them pictures, let's show them the reality. But then we should not instill fear in them, because then they wouldn't want to get tested. So we want to let them know that it's important to also get tested, periodically, to make sure that they don't have it. And if they want to have it, because sometimes you cannot stop them. So let them know what options are there, using condoms, um, being on contraceptive does not prevent you from having STIs or STDs. So we need to drill that in their head, that you still need another form of protection. And again, we shouldn't instill fear in them, so they can be open and be able to share, symptoms to us. And also, when we go for their doctor's appointment, let us get them tested as well.
And also, I wanted
Awesome.
to add to on the youth part, which is very very sensitive, because we all have children. And one thing I would urge is parents to, in the old days, when we're back home, there used to be a talk about growing up. So I think that growing up talk has been gone a long time
Yeah,
ago.
it's fading
We
out.
need to we need to bring that one back, because I remember we used to go to auntie's house, over the fire. We sit down, we talk, and she'll be talking stories, but with a meaning at the end, with
Yeah.
a story. And then you can ask questions because there's a trusting factor, So that auntie factor, for those parents who are listening today, take your children to an auntie that you trust so they can talk about those issues that when you grow up, you need to go for testing. If you are planning to be active, go to the clinics and have maybe a screen done, whatever has to be done, or test your partner too. Have that confidence to say, you know what? Yes, we all want to be sexually active, but let us all get tested. Every 6 months, we need to be tested whilst we're in this relationship. So I think education, but in a different way, an auntie, and also for the males too. A lot of males, you ask them, like she's saying, Joan, like the boy probably didn't even know what to do when you're having these sexual activities, you know. So also the boys need to have an uncle, dad, something like that, uncle, to talk to them about real life and about all these sexual activity diseases, so they can all get educated, but in a trusting way. Someone they can go to, they can call and say, uncle, you know what, Sheesh, I like this girl, but I don't want to mess up, so they can go for testing. There's nothing wrong about it. You have to be just like when you get married, you go check their their um, their credit score. Same thing. You check their status before you engage yourself into that relationship. Same thing. Okay. So that's one thing I wanted to add for the youth. So thank you.
Wow, 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 wow. Very, very vital information out here. Another informative session here on the Health and Wellness Hub. Thank you so much, ladies. This is a very, very important topic, and one of the very topics that we shy away from, and but you all have given us the knowledge that we need today, and education, especially to our young ones, to our children, to our teenagers. We need
Yeah.
to educate them. If you're a parent out there, you're not able to have these conversations with your children on their sexual life, sexual education. This is the kind of video you can just share with them. Just share with them. Let them listen. Let them
Mhm.
watch. As they're
Mm-hmm.
watching,
Mm-hmm.
they're getting the information that they need. Even if they
Mm-hmm.
are shy to come to you, they're getting it from the right source. We have healthcare professionals here who are experienced and are qualified. And so whatever they're telling us, they know what they're telling us. And they see it in their facilities every day, day in, day out. So please, 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 let's share the videos. Let's educate ourselves, our youth especially, so we don't fall prey to these diseases out there. Thank you so much, ladies. I'm very grateful. And we say thank you for coming on here. We know you're very busy. It's been a headache trying to schedule this,
Um,
but
I
thank God we've
know.
been able to. Yeah, we've been able to get it done. So thank you so much. I know you're busy. I really appreciate your time that you spent here and the effort that you've put in to educate us.
can I
So
say one thing?
yeah, please go ahead.
Yes, so this is the Ghana Nurses Association in Dallas Forward. Now you can follow us on our Facebook platform, Ghana Nurses DFW. Yeah, on Facebook, on Instagram, or on our website, GNADFW.org. Thank you.
Thank you. Thank you. And as I said earlier on, the Ghana Nurses Association, DFW, they are doing a very tremendous work. They're doing great things out there in Ghana, back home, even here, even in our community. Every month they help us, like, come on, let's exercise, let's keep fit, and then these are the kind of topics that they come out to educate the community on. So thank you all, GNA, DFW. Thank you. I know there are other nurses associations out there in the other states who are also doing same. So we thank you all for trying to help us to live healthy lives. All right.
And thank you, Sienna, for having us.
You're
Thank you for
welcome. You're
having
so
us.
welcome. We are grateful. We are grateful. All too soon, our time is up. We've come to another end of a great session. It's been an educative session. I always learn a whole lot from all these sessions. And as I said, it's free of charge. Nobody has to pay. So please share the video and let your friends and loved ones also watch and be educated and become a blessing onto them as well. Thank you for watching. And until we come your way again, another Saturday is been the Health and Wellness Hub on Sienna Media. Take care. And remember, your health is your wealth. Bye-bye for now.
Thank you. Bye bye.
Bye.